Welcome and thank you for joining us tonight for our virtual meetup, Data in the Greater Good. I'm Elaine Gamble. I'm the community leader of Data in the Greater Good. It's wonderful to have all of you with us tonight as we continue to have community virtually in these times. And it's been an honor to have wonderful speakers come and talk to us about how data enables their vision, it enriches the success of nonprofit organizations, whether it's the arts, social justice, environmentalism, and a number of other areas. We're honored to have with us tonight our first animal welfare organization, PAWs Chicago. And PAWs Chicago has certainly been setting a national standard in the adoption of pets and in its model. We have a pet joining us, which is wonderful. When we think of pets, we think of the love and joy that they bring us. And when we think about shelters for pets, we might assume that that is also a loving place for them, when in fact, it often is not. And many will go there to be euthanized, never having the joy of being matched with a loving family. PAWs at Chicago has been changing that. They've made dramatic change in Chicago as well as a number of other cities around the country. Data is a key enabler of their success. And two visionary leaders that are here with us tonight, Jack Druniak and Alexis Faceas, take the lead in success in the no-kill model. To tell you a little bit more about our speakers tonight, Jack Druniak is PAWs Chicago's Vice President of Performance and Program Improvement. Alexis Faceas, co-founder of PAWs Chicago, uses her business and legal background to build mission-based organizations and to build social entrepreneurship. In addition to serving as treasurer and supporting all of the operations, she oversees communications, financial, and legal management. Before we go into the heart of Jack and Alexis's talk, I also want to acknowledge and thank Bill Prickett for leading this virtual experience, as well as the video recording of tonight's session. Thank you, Bill. So on that note, I will turn it over to our two speakers, Jack Druniak and Alexis Faceas. It is truly an honor to have you with us here tonight for PAWs Chicago. Welcome.
Thank you so much, Elaine. And Bill, thank you for all of your support through this week. We're very, very pleased to be here and really to represent animal welfare in such an important group and initiative. Data really is changing everything, whether it's in the corporate world or in the not-for-profit world. And it's so great seeing a group of leaders come together and really talk about how it can make such an impact. So I will give you a little overview of what we're going to talk about tonight, and we're hoping to probably give a presentation for about 30-35 minutes, and then we'll open the floor for questions. So to begin with, we're just really going to talk about why data is so important to the industry. Then I'll go a little bit into PAWs Chicago's programs, into how we've really targeted the most important initiatives to allocate resources to really make the biggest difference all along the way through our evolution. We'll talk a little bit about some of those results in Chicago. Then Jack's going to go into a case study on some of the data, a different kind of aspect of data. I'm going to talk a bit more about mission-related data, but he's going to go into a case study on some of the digital marketing initiatives that we've been taking that have been kind of yielding some really important dividends in terms of engagement and just getting more people involved in our mission. And then we'll finish up with talking a little bit about where we go from here as an industry, as a country.
Where's she going?
And just some of the thoughts that we have in terms of what the next frontier could be for animal welfare. So to start, I'm going to set the stage with a short video clip about how my mom and I actually got involved in animal welfare 23 years ago.
So I went down and I said, you know, we would like to donate and contribute and help you because we think it's terrible. Our daughter's telling us how half of these animals are being killed. They said, it's not our fault, it's the society's fault. It's the public's fault. We have the dirty job of having to clean it up. So I thought, this really is awful. The public's not being told. People are bringing their pets in, giving them up because maybe their parents died. Children have allergies. And anyone can use these names. It doesn't translate into outcomes. Anyone can call themselves a humane society, a society for prevention of cruelty, an SPCA, an animal rescue, a humane league, an animal refuge or shelter. These are the names of these agencies all around America, not just in Chicago. So people are giving up their pets and they're being dead within 24 hours, sometimes within a few hours. This is, to me, fraud. There has to be a better way. I mean, how do you tell your children, this is how our society manages a problem? We just kill them.
So that is really the heart of what got my mom and I involved in animal welfare 23 years ago. I was volunteering for high school community service at a local shelter, and I had absolutely no idea what was happening to the vast majority, to over 60% of the animals that walked into that private shelter's doors every single year. And it was truly shocking to be there and be volunteering in a cat room, and all of a sudden, a kitten would sneeze and the worker would kind of rush over and ask which cat was it, because they wanted to mark an E on the kennel card so that animal would be killed that night. And it just really blew my mind that it wasn't widely known that this was the solution. It was sort of, animal shelters were kind of out of the way, not really front and center. Rescue was not front and center. At that time, most people would go to breeders or pet stores. I mean, I remember as a kid thinking we would go to the pet stores in the mall and you'd be looking at which breed you'd wanted. It was just a totally different world 23 years ago. And so when we started getting involved, we realized the single biggest issue in this field is a lack of transparency. And really what that comes down to is why data and transparency matter in animal welfare is really this kind of bullet here, which is numbers equals lives. In animal welfare, it's interesting. We have a business background. And so we're used to, looking at KPIs and financials and all of those things on a daily basis. The not-for-profit world, that's a relatively new iteration. And so often over the last 23 years, as we've built PAWs Chicago from a grassroots organization, we've heard people come forward and from the nonprofit sector that come to PAWs and they say, why do you guys always talk about numbers? This organization is just about numbers, because a lot of times people who are motivated or historically have been motivated in not-for-profit are heart motivated. But the reality is numbers equals lives. So if we're not measuring, tracking, and understanding where we are, how can we possibly know how to invest and allocate our resources to make the biggest impact to get where we want to be? So that really is, I think, the number one driver of what we do at PAWs Chicago. Another key reason why data and transparency matter is that what my mom has known from the beginning, when she decided, after kind of us getting involved and seeing the mass scale of euthanasia in Chicago, she decided to have an event, because she said, I can't get my friends to come down to the city pound or to the shelter. She said, but I can get them into public spaces. So how do we bring this issue into the light of day? And how do we tell people what's happening? Because people do get mobilized and inspired to act when they actually know that there's a problem. So a lack of transparency really suppresses the people becoming engaged who would otherwise care and want to make a difference. Kind of this third bullet here that is also another indicator of why we think data and transparency is so important is the killing of homeless pets, unlike most issues in our society, is a solvable problem. Minimal relative to, massive crises that impact our communities. With relatively modest investments of resources, this problem actually goes away. And we'll show you how that happens with the right kind of strategic approach to investing resources. And really what that does long term is it preserves resources for other issues and enables us to take the field further into the future. And then finally, the reason data is so important is it really has guided how we decide to allocate the resources that we get. In animal welfare, there is a significant limitation in the amount of resources that are available to us. We do not typically get government funding. The only government funding that really occurs for animal welfare is for city impoundment facilities that are responsible for keeping the streets clear and being a resource for cities and communities. When people can't keep their pets, they can take their pet to the city pound. But other than that, government doesn't really do all that much for animals, which in some ways has enabled us in the private sector to get more involved and make even more of a difference, because we don't have some of the barriers and handcuffs that too much government involvement can often lead to. So those are some of the kind of leading factors as to why we've felt like data and transparency has been one of the most important issues from the beginning. So this article came out on May 4th, 1997. It was the year that I was volunteering for high school community service at that private shelter. And I had no idea, just from my experience in that one place, how magnified the problem was across the city. But this title, unfortunately, the article that we have is very faded, but it says disposable pets, 40,000 dogs and cats put to death here in a year. And it talked about how Chicago had one of the worst euthanasia problems in the country. And what that data was at that time was that 42,561 homeless cats and dogs were killed that year in 1997. And the reality is no one knew about it. This is one article that came out. And that year, Animal Care and Control, the city pound in Chicago, they euthanized 26,000 out of the 28,000 pets coming in. That was 93% of the animals that came into the city pound that year were killed. So it just goes to show how terrible the scenario was for animals, and it was not a part of public discourse at all. And so what we did is my mom decided, let's have an event. And so she invited all of the local shelters to participate. And she went to the stores on Michigan Avenue and Oak Street. And so we invited for one day, had an adoption event in the Magnificent Mile in Chicago. And what that did is it really put a spotlight on the problem. We passed out materials. Ogilvy and Mather did our pro bono marketing for that event. And we passed out these beautiful materials talking about how pet overpopulation and the resulting euthanasia was a huge crisis in our city. All of the news stations came out talking about how they couldn't believe how many animals were being killed in our city. The next day at my mom's office, she had dozens of calls from people saying, how do I get involved? I love what I saw. How can we make a difference? And really, we just started having an event. We didn't have an organization at that time. But what we saw was that once the community actually was engaged in this as being a serious problem, people started stepping forward and saying, I want to be part of this solution. And so as we developed our model over the last 23 years, we really start with this foundation of community engagement. Everything that we do is built on how do we get more people into the cause of pet homelessness. We often say that, people create the problem for homeless pets and people solve the problem for homeless pets. Animals are victims all along the way. And that's why really engaging people and advocates and supporters in this cause is the most important thing that we've done in the last 23 years. But on top of that, we have 4 different pillars that we view are absolutely essential if you want to create a no-kill community. And I'm going to go in detail into 2 of these pillars today, but the pillars just on kind of a high level are prevention, which is really spay-neuter services. There are kind of 2 ways that you can address pet homelessness and pet overpopulation. You can either reduce the supply of homeless animals that are born, bred, coming into shelters, or you can increase the demand of the number of homes that want to rescue, adopt, and save these animals. And so this model really does both of those things. The prevention arm is truly targeted at reducing the overpopulation. We then go, adoption is absolutely critical. That's how we find new homes for these animals who are otherwise at risk. And at PAWs, our prevention efforts have been so successful in Chicago that we are now able to take animals from 14 high-risk states across the nation where they do not have robust prevention programs, where they still have significant numbers of animals coming in. I mean, we hear horror stories about how litters of puppies are literally put in pillowcases and drowned in the river because there aren't places for these animals to go. So by us creating a transport vehicle for animals to come to Chicago, we are able to really reach a population of animals that otherwise would not have a positive outcome. The other area that I really want to go into in detail today is the animal health and behavior area, because that is the key difference for what creates a no-kill community. It really is the investment in the life of every individual animal that matters to us. And so without robust shelter medicine and behavior modification programs, you're really not going to be able to address the significant number of the needs that homeless animals have when they come into us. And then finally, volunteers is a pillar because we could not do our work without it. Last year, our volunteers provided us 149,000 hours, which was the equivalent of 71 full-time employees. The work that is involved, the labor that is involved in caring for, rehabilitating, and treating animals across the board in the robustness of this model is so extensive that we could absolutely never afford to provide that level of care if we had to pay for it. So volunteer engagement is absolutely critical for us to really do the work that we do. Prevention, because this is actually what we started with at PAWs. In the year 2000, we opened our Lurie's Spay Neuter Clinic. And we started there because when you're looking at a problem, the scale of 42,000 animals being killed in 1 year, there's really such a little impact that you can make by opening connections for a few adopters here or there. That takes time to build. The real key driver to mitigate this mass scale euthanasia is reducing that 42,000 number from even coming in. And so spay neuter is not the sexiest part of the animal welfare industry, but it is definitively the most important part, because one spay neuter surgery of $100, $150, depending on where you are at cost, prevents dozens of animals from being born to that one pet. When you actually look at the exponential impact of breeding, it's extraordinary because pets breed so prolifically, so many times in their life. They start so early that if they're not put under control in terms of limited and in terms of being given a spay neuter surgery or being taken off the streets, that those breedings just continue and continue and continue. And that's how we got to the point where there were so many animals coming in Chicago. So the real solution is targeted, free, and low-cost spay neuter. What we find is that overall across America, on average, about 80% of people just naturally get their pets spayed and neutered. What we find when we go into economically challenged and underserved communities, that number is about 4%, and between 4 and 10%, depending on the community. But the challenge is that on a retail veterinary basis, the surgeries cost anywhere from $300 to $500, and it's not affordable for families who are already struggling to make ends meet. And so what we, so really providing that service for free and low cost is absolutely critical. What we see is that the vast majority of pet overpopulation originates and correlates to low-income communities. So that's why locating these spay neuter services and our prevention resources in underserved communities where the source of pet overpopulation is the most important part of the spay neuter equation. In 2014, we actually added to our spay neuter clinic a door-to-door outreach component where we have social workers that have targeted specific areas in Chicago, in Inglewood and West Inglewood, and then we recently added back of the Yards, which are communities where our social workers, our interns, and our volunteers go door-to-door and support people with helping them with their animal challenges. What we find is that most people absolutely love their pets. They just don't have access. And similar to other types of resource deserts that underserved communities are, where there's food issues and medical issues and all of that in terms of access, there are no veterinary resources either. There are pet resource deserts. And so by us going door to door and providing resources directly in those most challenged communities, we've seen a tremendous transformation. Previously, it would be similar to some of your travels abroad where you'd go by and you'd see animals walking just along the streets. And now you go by and there aren't animals to be found on the streets anymore after 6 years of intensive, support that we've allocated in those regions. And in addition, what we do is in our targeted communities, we provide additional resources like a pet food pantry and community medicine, which is since there is no access to veterinarians in underserved communities, we actually provide a veterinarian once a week to be able to help triage with problems that animals otherwise would be suffering with and people wouldn't be able to help remedy. So those are some of the areas that are really that we've really focused on in terms of prevention. What we see with our Lurie Spay Neuter Clinic is that we've grown our number of surgeries over the years. In more recent years, it's actually harder to get as many surgeries because as we go into more underserved communities, they require a lot more resources to be able to get them spayed or neutered. So sometimes there's matting, there's additional medical care that's required. So we're not able to get actually as many spay neuters done as we were in prior years, but we're actually targeting those surgeries, the ones that matter most. What we have seen when we look at data and worked with data analysts at targeting the spay neuter problem is that actually each subsequent year that you offer more and more spay neuter, you see fewer and fewer animals on the streets breeding because a greater proportion of the animal population is spayed or neutered. It's not just one and done. So so it's really interesting looking at the cumulative impact and how important it is to maintain those services, to not start them and then go away, because this problem comes right back without the continued allocation of resources. What we did when we just wanted to determine where we're going to identify the location for our spay neuter clinic is we started tracking the number of stray calls in the city of Chicago. So as you can see, in 2004, there were 15 what we called red zones, which had zip codes where there were more than 600 stray calls in that year. And we located our spay neuter clinic right here, which was kind of in the middle of this red zone area. We actually had a space that was donated. And then here in 2014, we started doing our door-to-door outreach. And what you can see is how we've been able to significantly improve and reduce the number of stray animals across the board over this. This was a 14-year period. So that's kind of the basics of what I wanted to cover in prevention. I'll now move over to our animal health and behavior pillar. And the reason I wanted to touch on this is it's the most critical pillar to understand what no-kill means. And no-kill is all in the definition. And so the real question that we ask is, when is it justified to take a life? And in a no-kill model, basically you save all healthy and all treatable animals. And you reserve euthanasia only for those pets that are irremediably suffering, in which medical treatment could not alleviate their condition and their suffering, or for those animals who are behaviorally dangerous and which no amount of behavior modification could reasonably keep people or other pets safe. And so it's a very high bar. A typical rule of thumb that has been used to evaluate whether a shelter is no-kill is to determine whether they are saving more than 90% of their animals. However, that is not the actual definition. The actual definition is, are they saving all healthy and treatable animals? It's more of a barometer and a temperature to determine how close to no-kill is that organization. I will say that at PAWs, our save rate has never been below 97%. And so I think most of the movement is moving towards really that threshold would probably be a 95% ratio if we were, looking at modern science and the modern medical care that we have. But it's also kind of important to look at definitions of what does healthy mean and what does treatable mean. So healthy is a pretty standard definition. There's no sign of disease, injury, no behavior characteristics that would pose a health or safety risk. Treatable has been the challenging issue for our industry because the definition for that actually depends on the individual shelter and the individual community. And so this next slide will kind of show you what I mean by that. So at PAWs on the left here, unhealthy and untreatable medical conditions are just this small group of medical. We actually had an experience with a local Chicago shelter, and one of the challenges is that since there is no standardized definition, what organizations have been encouraged to do is to develop a community standard, kind of like that reasonable person standard that's very common in the legal industry, where what would a reasonable pet owner consider was treatable in Chicago? so that way you're not putting a higher burden on shelters, and perhaps in a lower income community that we've done some work in some of the challenged post-Hurricane Katrina communities with spay neuter in the New Orleans area. And what is affordable there in terms of a reasonable pet owner is completely different than what a reasonable pet owner in Chicago would do. So it does make sense to potentially have some continuum of slide. However, really from our perspective, no kill is no kill. If it's a treatable condition, we should count it as a treatable death. What was interesting is in Chicago, a separate organization actually created what they thought their list of unhealthy and untreatable was. And as you can see, all of this on the right, it includes things like diabetes, which can be managed with insulin. It includes FIV, which most shelters today don't even view as a challenge. I mean, something as simple as incontinence or a luxating patella or an amputation or blindness. They're considering those unhealthy and untreatable. And the reality is that is the problem that we're dealing with when it comes to transparency in this industry. Because if somebody would say that, okay, well, if a dog has cancer, we're going to euthanize it and it's unhealthy and it's untreatable. I'm sorry, but that is not a no-kill organization. Most cancers can be resected or managed, or at least put into hospice care so that animal can live out its life. And so I feel like this slide is really important at showcasing the difference between what a no-kill standard would be and oftentimes what a more traditional standard in the animal welfare or world would be, in terms of what's really savable and where our resources should go in terms of saving animals. This, I just kind of wanted to end this with, just to show you a little bit of our data, because we feel like data transparency is probably the single most important thing that we do, because what we want to do, so we report on how many euthanasias, how many died in care, both behavioral and medical, in our organization every year. It's really important. And as you can see, on the dog side, our save rate was 98.43%. On the cat side, it was 97.39%. The reason is that oftentimes cats have much more serious diseases, especially vulnerable kittens. For some reason, like parvovirus, we seem to have a better success rate at treating vulnerable puppies than sometimes a lot of the kitten diseases that will just rage during kitten season. So a lot of times what you see here is on the cat side, we have more medical euthanasias and more animals that end up perishing with we call it kind of fatal kitten failure to thrive for kittens. And it's just a reality of the different species, unfortunately. But we do have one of the most state-of-the-art medical centers in the country and we're just about to finish our new $8 million renovation on our medical center. So it's going to be truly best in class, opening this fall. So we're really excited about that. The other area that's really important to talk about is the behavior side of things. We have 3 full-time behaviorists and trainers at PAWs, because really in a no-kill, we don't believe if an animal is rehabilitatable, if we can find the right home for them, if we feel that they can be managed well and safely and have a thriving life, we will do everything in our power to save them. And so we have every year around a population of 150 what we call level 3 dogs that we end up finding homes for, that take a lot longer because it requires, sometimes they're totally fear-based. Either they're fearful of men, or they can't be around children because there's a trauma or there's a separation anxiety. So it's not just medical conditions like heart. We do pacemakers. We'll do massive medical interventions, especially when the animal will have a fantastic life. But it's also on the behavior side. We have really robust foster and trainers that will really make sure that every animal is saved. And so that's sort of a bit about what we do on a day-to-day programmatic basis. But I did want to showcase a few of the data points here, because I think it's so important to show that really at the city the city pound, which is really the barometer for how well a community is doing when it comes to on the path towards no kill. Euthanasia has decreased more than 93% since we started. More than 65% of that is from fewer animals entering shelters. That right there shows the importance of prevention and spay neuter, because intake has declined by more than half. And so that is, all of a sudden you're dealing with half the number of animals. You can give them better care, you can give them better outcomes. Private shelters can actually choose what their intake policies are, but animal care and control organizations have to take in from the public. So this really is the benchmark for how well a community is doing. If there's too many coming in, they have no choice. They have to euthanize if they don't have other rescue partners or adopters or other programs to come in and take those animals. So we really view animal care and control as a really important indicator. But we can also look at the overall euthanasia in the city of Chicago, which went from over 42,000 to last year, we're under 4,000 animals were euthanized. And so that's a reduction of euthanasia by more than 91% since we started. So I'm going to turn this over to Jack now. He's going to talk a little bit about a different type of data metric, which is how do we engage more people in our adoption programs, in our mission overall.
Thanks, Alexis. And I just want to start out by thanking Bill and Elaine for inviting us to this and pulling this all together. It's an honor to be here tonight. As Alexis and I were thinking about what we wanted to present tonight, obviously the data that Alexis just went through is absolutely critical to the mission of PAWs Chicago. But we were thinking of how about we present kind of the flip side of how we went through a process of unlocking an untapped potential of data that we historically maybe underutilized. And to give a little bit of context, our adoption process was somewhat tied to our shelter management system in that the workflow and the application worked through that system. And if you think about shelter management, if you've been to a doctor's office, it's the equivalent of an electronic medical record, right? It's not designed to be a constituent management system. It's not designed to give you the types of data you might need from an engagement perspective. So we were forced into this kind of limited ability to engage our potential adopters, to provide information, but also we were losing a significant amount of data that it comes through on a normal application. So Alexis, if you flip to the next slide. When we sat down and thought about how do we want to redesign this process on the front end and also the back end operations that support it, we tried to think of what do not just adopters, but consumers in general want, right? They want to be informed, they want immediacy, and they want it to be personalized, amongst many other things. So we sat down, and as we approached what eventually became known as our compatibility program, is we wanted to make it fun for potential adopters. We wanted to make it interactive. We wanted to make it personalized, almost like everyone who fills out an application gets a little bit of a personalized concierge approach. Obviously, we want to make it easier for our potential adopters so that if they're sitting at, on their couch at 2 a.m, they can have the same experience as if they're walking through our adoption center in terms of learning about the animals and what's right for them. On the back end, what we wanted to do is create a more proactive communication approach that really provides the right type of communications to people entering our system at the right time. Additionally, we said increased funnel visibility, but honestly, we needed to create the funnel. Like the data was there, we just didn't have a mechanism to extract it and actually show us what our potential adopters were telling us. So if we go to the next slide, what we ended up creating ended up being a 2-part system, right? There's the front end, what you might experience as an adopter, and there's the back end items that we were able to achieve organizationally. First of all, we sat down and we deconstructed the whole experience of a potential adopter and all the different points that they interact with us. And we streamlined where we could, we automated where we could. And now it's you give us some information by completing our compatibility quiz and application, and almost immediately we're able to give you a personalized PAW rating scorecard on the types of animals that, based on what you tell us, and the way that we set up our matching algorithm on the back end, we can say generally look for these types of animals that have these types of PAW ratings. And then you can take that either into our adoption centers or online and start searching, by different categories. So do I have kids in the home? Do I have a dog in the home? If I have a cat, what kind of enrichment is required? And based on what you tell us, we're able to give you that more personalized approach. On the back end, it's really helped us a lot because we have so much richer data now on our constituents who are engaging with us, not just um, at the high level of just page views, but really like as they come into our funnel and where they're moving through it. So you can see here that we were actually able to create a funnel, and this process started in August of last year, I want to say, as we were starting to formulate it, and we were able to implement it earlier this year, just in time, luckily, because it's come in handy with our virtual adoption process. But now we can actually see unique page views, click-through rates to our quiz, our completed applications, and really what it's brought in is a sense of transparency into how people are engaging with us. But it also gives us, as you can see there, we have 23,000 new subscribers that previously we weren't able to engage with you if we didn't get that information. So now we can bring you in from an education perspective. We can bring you in potentially into our foster, our volunteer, potentially donor-based work streams, and we can start to build that longer-term relationship with you. And actually, anecdotally, just last month, we were able to, because we had this significant piece of data that was now available to us on potential adopters. Alexis mentioned that there were a subset of dogs and cats really that need a certain type of home, a certain type of adopter. We were able to actually mine that data and pinpoint with a significant degree of certainty that the people that we were going to send a very targeted communication to actually matched those types of animals. So we can almost do a little bit more of a matchmaking, pairing, and outreach component. So we're hoping that the early successes of this will actually provide a springboard for the organization in general and how we, one, manage our constituents, but two, evolve our interaction and our ongoing relationship building with our different stakeholders.
Great. Thank you so much, Jack. Yeah, this was a huge movement forward for us. And we actually already have shelters who have been reaching out and asking us how if we can share the tech and the overall design. And so we're working on spreading this across the industry, which is great. So kind of to wrap up, I really wanted to close with looking at, what are some of the barriers to creating a no-kill nation? And truly, lack of transparency is probably the number one issue, because we don't always know what is happening behind closed doors in shelters. It's very difficult to really know and to pinpoint where the vast majority of issues are taking place in our country. And so hopefully as time goes on, we're able to drive forward more of an urgency and a need for this type of transparency. A lot of organizations are working on that. But to dovetail on that, a lack of standardized and detailed reporting is part of the challenge. There are standardized high-level reports, but when you're actually wanting to get down to creating a truly no-kill community, knowing the details around the types of animals that are not being able to be saved is absolutely critical. Because, for example, during a couple months ago, we got a call from a transport partner that said, they had a puppy that needed a pacemaker, $3,000 surgery. Frankly, no shelter veterinarian is going to have that level of specialty. That's why they cost so much. And they went to 20 different shelters, and we said, yeah, we'll take it in. But that's a puppy that most likely would have been euthanized if they weren't able to reach us. And when you look at it, not knowing so are we getting to a point where the closer that you get to no kill, the harder each incremental animal is to save. It tends to be more of an investment in terms of medical care, or much more of an investment in terms of behavior modification and training support. And so knowing exactly where communities and organizations and states are on that continuum is really important to know where to dedicate resources. The next challenge that we see a lot is really more a result of this lack of transparency and lack of standardized reporting, but it's uninformed donors. Most animal welfare donors are completely moved by the cause because they absolutely love animals, and they are very emotionally motivated in their giving. The challenge is that oftentimes just because you receive a communication with an animal in need, it doesn't necessarily mean that you're sending a check to an organization that is committed to the highest quality of care for those animals. And so truly, like, that uninformed donor component is very difficult, because I would say the vast majority of people that when we started PAWs, that would think that an animal shelter would be a refuge and a safe place for an animal, they would have had no idea that the vast majority of animals coming in were being killed. And so that uninformed donor perspective ties into this lack of transparency, this lack of standardization of detailed reporting. And then finally, there is a resistance to no kill. And it tends to be from organizations that have historically managed by euthanizing, because, as I said, with each incremental animal that we're saving, there's more and more resources that are required. So I'll never forget, we were at the city pound, this was a few years ago, and we were looking for a nursing mom, because oftentimes if you have a litter of neonatal kittens, they can latch onto a mom that's already nursing. So you don't have to send it to a foster home where people have to be up every 3 to 4 hours to bottle feed these babies. And the workers' reaction was, well, why don't you just kill them? And it was a really poignant moment, because that right there shows the difference. Like, when you're acclimated to euthanasia as a management tool, it becomes something that, because you're doing it, you have to emotionally accept it. And it's, and really it takes us back to why animal shelters were founded in the first place. Animal shelters were not founded in the 1800s to save animals. They were founded to kill animals more humanely. So euthanasia has been a part of animal sheltering since its inception. At that time, animal control organizations were shooting and clubbing and drowning animals to death. And so shelters said, at least we can give them a humane death. So it was an improvement. But we've come so far. We really have to leave behind us that mentality where euthanasia is a management tool, and shift into really focusing on the individual animal and how do we do the best we can for this animal. We know we're never going to save 100%, but I think at least if we can get to that 95% threshold, we're really doing the best service we can for animals. And then finally, I kind of wanted to end with an idea of what's next in this field. And what we see at PAWs Chicago is a need for a national donor advocacy platform. And I thought that you would be a great group of people to share this with, in the event that anyone here is really interested in this cause and in this industry and would want to be involved in the inception of something that would, we think, make the biggest impact going forward for animals. We really want to see and to help create, not as part of PAWs, but as an independent organization, an independent data-driven organization that can evaluate animal welfare nonprofits on a standardized basis based on performance and outcomes. And we really see this as absolutely critical, kind of the transformation that Charity Navigator has made in terms of donors looking at what is the biggest, best investment that they can make to make the biggest impact in the type of industry or organization or sector that they're interested in. We really feel like within animal welfare, this is absolutely an essential tool that would be able to support donors in stewarding resources in a manner that's consistent with their values and their ethics. Because I know so many people who have historically given to shelters, and when they found out that they euthanized, they were shocked and truly in despair that they thought that they were supporting an organization that had their same values when it came to animals. And it's just not the case across the board. And so what you'll see, I really encourage you, if you're involved with organizations, to really go online and see how easy it is to find their data. How easy is it to find out what their euthanasia rates are, what their outcomes are, what their save rate is, how many spay-neuter surgeries are they doing, where are they doing spay-neuter, is it for communities that wouldn't be able to afford it? All of those things are really critical in assessing the efficacy of the organizations that you support. We really see an organization like this being able to, down the road, actually direct funding to organizations who opt into audits, so that there could be a kind of back-end fact check and audit process that could really verify and give donors the peace of mind that the organizations they're supporting are really doing good work. And we really feel that that raises the bar in the industry. And then finally, we do view that this organization could potentially have a consulting arm that could provide operational support to organizations, that could raise the bar in how overall the industry is performing when it comes to animals. So I think we'll leave it at that. Here's Jack and my contact information if you are interested in learning more, or even just finding out questions that you have on the industry. We're always happy to be a resource, and would love to have additional conversation. We can't hear you, Elaine. You're on mute.
Sorry. Thank you so much, Jack and Alexis. Excellent discussion, inspiring discussion. I have the first question. I will start out with that. How has COVID-19 and the times that we're in impacted your work? Earlier in your presentation, when you were talking about the data, volunteers are a key driver of your success, the equivalent of 70 employees, I believe it was. So in these times now, how has that impacted your ability to give optimal care to animals?
Well, I will turn this over to Jack in a few moments. I'll kind of start with, because he's managing a lot of the adoption center process and the rapid evolution that we had to go through. But I'll start by saying, the biggest disappointment for us when COVID hit was needing to close our spay-neuter clinic. At that time, nobody really knew the impact and how high risk it was. And we have typically 80 to 100 people coming into our spay-neuter clinic every day for high volume spay-neuter. We do very low cost vaccinations. And so we knew we needed to change that. And so what we did is we had to cancel our clinic. It was unfortunately leading up to kitten season and puppy season. So a lot of what we do in those spring months are trap, neuter, return for feral cats that are on the streets. And so unfortunately, we're now seeing a bit larger kitten season than we would have otherwise seen, because we weren't able to get a lot of those ferals in for spay neuter surgery. And now we have months of a wait list of people wanting to spay and neuter their pets. So that was a really tough decision. The good news is that because we are so proactive in the space, and because a lot of the technology, Jack was involved on a daily basis as the laws were changing how our operations. So Jack, I'll turn it over to you to talk a little bit about how we were able to kind of maintain our adoption flow.
Yeah, it was interesting. Thankfully, we were able to get compatibility up and running before this all happened, because that's played an instrumental role in our ability to do this. So it almost seemed like we went from an in-person adoption process to a completely virtual adoption process in the span of about 48 hours. And Elaine, to your point, we are so dependent on volunteers because we have a lot of this information digitally and on our website, and we're able to access it remotely. We've actually been able to utilize a lot of the same volunteers who would help us in person are now helping us with various points in the adoption process. So it was interesting. At one point, we had several thousand people reaching out to help foster, and that was pretty consistent across other organizations too. It just the outreach of people thinking, what, I'm home for several months now. Maybe this is the right time if I've been kind of on the fence. So we've actually been able to, since March 26th, while adhering to extremely strict distancing and disinfection protocols, been able to continue our adoption by appointment, where people will submit their adoption inquiry, we'll reach out to them, and we're able to help move them through the process. So really, when they get into the building, they're a lot more informed about adoption and the animal itself. And really, it's just they're there to meet the animal, and if everything goes well, they're able to sign and walk out.
Mm-hmm. Excellent.
It's really a testament to Jack and his team that we didn't go one day with our adoption center closed. It's just as consistently just been an iteration process. And I think we're only down about 10% from last year to date in terms of adoptions. Yeah. So really, we've been able to maintain throughout this, even though it was a lot of, fly as you go, create the system as you're driving kind of processing, we've really been able to maintain that flow. And it's been so important because a lot of our rescue and transport partners said that we were one of the only places that they could send animals to. Other states closed down to animals coming in. It was a really difficult time for animals who are at risk. So we feel very grateful that we were able to keep that life-saving train going.
Any questions from the audience? Any questions from anyone? Well, I actually also wanted to ask you, the ASPCA, which is probably, I guess, in terms of brand, they have a pretty big brand in advocacy, yet not necessarily hands-on the way you are in working with the animals. So what is your relationship with them? What is the nature of it? How do you collaborate? Do you collaborate around data? Do you collaborate around
ASPCA
other areas?
Yeah, they do some great work when it comes to like advocacy and outreach. We really find a lot of the nationals where their real sweet spot is reaching volumes of people, talking about issues. What we don't see is as much of the hands-on life-saving that you see with the more local organizations. So we always tell people, if you really want to save the lives directly of animals, support your local shelters. If you want to try to help drive the winds, get behind the winds of change and looking at overall sometimes the legislative process, a lot of the nationals will be much more hands-on and involved in the sweeping advocacy type issues. ASPCA in particular, they do some really great national work when it comes to, they have a behavior center. Unfortunately, our experience with them is that they have not really adopted the no-kill platform. And so they've limited a little bit of how we can engage with them because we are no kill. So that's one of the examples of things that where that issue kind of can drive a wedge in terms of how we can engage. But they do some really great work on the behavior side, on the spay neuter side. So yeah, but we don't really work directly with them at this point.
What types of pets are the most difficult to get adopted, and how is that navigated with the compatibility algorithm? So as an example, in the no-kill model, an animal that has a condition, diabetes, etc., that's treatable, of course. However, not everyone could afford perhaps the treatment for an animal like that. Does then that skew more to a higher income person? Does it not? How does that work? And who are the most difficult animals to get adopted? And then how do you manage finding homes for them, given the extra responsibility a pet owner might have?
I'll start and then I'll turn it over to Jack because I know he has a lot of experience with this as well. So from what I've seen, the single most difficult determining factor is behavior challenges. What's remarkable is that truly we do not have issues with medical challenges with animals. Amputations, blindness, diabetes, like if it's a loving, sweet, gentle, easy to care for animal, those animals get just scooped up. We don't seem to have an issue with seeing those animals longer term. We did have a dog with us for 3 years who was paralyzed with his back legs. He was shot and defending his owner. And he had rear paralysis, so he had his little wheelchair, and he had to be expressed every day. And so he was with us for 3 years because obviously that's a very complicated procedure, but we ended up finding a paramedic who just fell in love with him and took him home, and she did all the expressing and everything. He lived so many years there and was just like, so he's a total love when it comes to like the PAWs family. But yeah, medical issues are not a problem. Really, the behavioral challenges are the biggest issue. And Jack, I'll let you kind of dovetail off of that.
Yeah. So when we were developing compatibility, you'll notice if you take some time after to go, complete a quiz or something, you'll see that, it's based on children in the home, pets in the home, both cats and dogs, enrichment needs, activity level. And what we did is, it looks on the surface very simplistic, but really what it was is taking a lot of the work that our canine and feline training teams do with their evaluations, their observations, what we pull in from information that's provided to us from our fosters, from our volunteers in the center, and that's what goes into the ratings you see on the website. So for example, if we know that a dog just can't live with another dog, that factors into the rating and they won't necessarily be rated as high. So that way what we're trying to do is, when you say, I don't really want another dog, or I don't need a dog that's social, it opens you up to a broader perspective or a broader spectrum of available animals to you. And then really the compatibility is kind of the front end. Where it really starts to get in is the education component and the conversations that take place with our training teams, with our volunteers, with our adoption staff, to really make sure that we're putting the animal in the right situation, but also the adopter in a situation that's manageable for them, because our goal is permanent placement.
Thank you. Well, we're actually right at 8 o'clock. And again, thank you so much for this inspiring discussion and our first animal welfare organization, and certainly have appreciated this very much. Thank you both so much for joining us at Data and the Greater Good. Fantastic job. Thank you.
Thank you so much for having us.
Thank you so much.